Hi, I'm Emily Bright, and I'm going to be starting a primary infusion today on Ellen Davis, date of birth 9/19 of 63, and Dr. Jones has ordered 500 milliliters of sodium chloride at 125 milliliters per hour times one bag. So if I divide the 500 milliliters by 125 milliliters, that gives me 4. So that means that this infusion will take 4 hours to finish the entire bag. Hi, my name's Emily. I'm going to be your nurse today, and we're going to be starting a bag of IV fluids on you. These fluids are just to keep you hydrated, to give you a little extra that you're maybe not drinking, and to help with some electrolytes. I see that the other nurse has already started your IV, and that's great. Can I have your name and date of birth, please? Perfect, Miss Davis. I'm going to look at your armband just to make sure. Very good. Now what I'm going to do is I'm just going to look at your site here where the IV is, and I'm just looking to make sure that there's no swelling, infiltration, which means that the fluid's going under the skin instead of into the vein, phlebitis, which is if it's warm and red. We call it angry. I'm also going to check to see if there's any signs of infection, and it looks great. So we're going to get ready to start this bag of IV fluids on you, okay? And I will explain it the entire time. I have here my 500 milliliter bag of sodium chloride. I'm just going to take that out of the bag. And I dropped my cup. Got it. So what I have here is sodium chloride. And it looks like the expiration date is July of 2021, so we're well within our expiration date. Let's see, 500 milliliters, and it looks clear, which is what we want. We don't want any cloudiness or any sediment in there. So what I'm going to do is I'm going to hang this up here on my IV pole that's too short, and I'm aware of that. I put them too low on the wall. So, now what I'm going to do is I'm going to do some hand hygiene, wash my hands up here, and get some gloves on. And while I'm doing that, I will explain that this primary bag of IV fluids will go directly into the IV that's already in her arm. So, that we don't have to do anything with that. I have here my primary tubing set, and it looks like everything looks good on that. We're just going to rip into this, open it up, and there's just a little band around it that you have to remove that holds it all together because there's a lot of tubing here. And I am going to unravel it here so that I've got a little bit more room to work. I'm going to take the clamp and roll it down so that it's closed. Otherwise, we're going to be wearing IV fluid, and we don't want to do that. So, I am going to, right now, take this end off of what they call the spike, which goes into the bag. And I'm going to take this plastic piece off of the bag, keeping both of them untouched so that they remain aseptic. I'm sticking the spike into the hole that I just took the cap off of and twisting it back and forth so that it gets inside the bag. In a perfect world, it's inside the bag. Now I'm squeezing this right here, and I'm squeezing it so that I get some fluid out of the bag and into here about halfway, between a third and a halfway up. That looks good. Now, cap right there and my end right there. I'm going to hook this over here while I prepare her site on her arm. What I'm going to do first is I'm going to take an alcohol swab, and I'm going to wipe the end of her port here, and the port is the end of the IV. where we're going to put our bag of fluids. Perfect. Now I will let that air dry while I take a piece of tape, and on that piece of tape, what I'm going to do is put the date and the time that I'm starting this, and I'm going to add it to the tubing, because the tubing can be used for a different bag as well. So I'm putting today's date, I'm putting the time, which does not like my gloves. I have the date, the time, and my initials on this piece of tape, and I'm going to put it on the tubing so that that tubing can be used again, but it will have to be replaced within 24 hours. So if it's used again before the 24 hours, that's fine. Once it hits the 24 hours, we're going to put a whole new set on there. I don't need my flushes right now, so I don't have those. All right, what we're going to do is we're going to what's called prime this tubing. And how we don't want to start this when it's full of air. We need to get this full of the sodium chloride. So what we're going to do is, I have a cup here. Any receptacle will do as long as it will catch liquid. I have liquid in here, so it's already ready to go. I'm going to take this cap off and hold it in this hand so that it doesn't get dirty. I'm going to hold this facing down because this might come quick, depending on how quickly I unroll the roller. Now, I want this to start dripping up here, which it's doing, which means it's coming down the tubing. Down, down, down the tubing. It really is, I promise. I've got her wide. There we go. Perfect. All right. Now, I'm going to replace the lid without touching anything so that the ends remain as sterile as possible, but aseptic if not sterile. Now, what I'm doing here is I'm checking the tubing for any bubbles. And if you see any bubbles, you're going to flick the tubing to get the bubbles out. It's easiest to hold it above here. And then the excess fluid goes back into this port right here so that it doesn't stay in the tubing. I'm going to check all of my ports here that might get attachments for any additional medications that are needed and make sure that there's no bubbles in those. Perfect. And this is ready to be attached to the IV. So the lid is on, so it is still sterile. I already wiped this one time, but I'm going to do it again just because it's been sitting there in it. It could get dust and dirt and anything else on it. So I want to rub, 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 rub. I'm going to keep rubbing to make sure that the end of this port is very, very, very clean. You do not want to introduce anything into this IV because it goes directly into the vein. So we need to keep this whole process as clean and sterile as possible. So what I'm going to do is I'm going to take these gloves off. I'm going to perform hand hygiene. I'm going to get another pair of gloves, put them on. Perfect. And what I'm going to do now is I'm going to get my drips per minute. And the doctor wants this to run at 125 milliliters per hour. So in order to get that, I need to multiply the number of milliliters in 60 minutes by the drop factor in drops per milliliter, and then I'm going to divide by 60 minutes. So if I do that, 125 over 1 hour at 10 drops per milliliter, and I get 20.83 drops per minute. Now you want to round up because there's no way to count 0.83 drops per minute. So I'm going to use my rounding rules and round up to 21 drops per minute. Now, if there's 60 seconds in every minute, I can figure out that 60 divided by the 21 drops equals approximately 2.85, and I'm going to round that up to 3, and I'm going to get 1 drop every 3 seconds, and that will get me my 21 drops per minute. So, in order to do that, I'm going to take this, and it's easiest to count these drips in this chamber right here. Okay? So, I'm going to take this end, which still has the cap on it, and I'm going to uncap it, and I'm going to put it onto my current IV site, which still looks good. We have no extra swelling, we have no redness, it's not warm to the touch, so we're good on that. And I am just going to fix my bag to make sure that this stays in there. Because when I practiced, I made a big mess. And I probably will again. So, advance warning. There you go. Okay, now to get 7, I need to get my roller clamp here. And to get the 17 drops per minute, what I'm going to do is I'm going to count 1 drop every 3 seconds. So I'm going to slowly open my roller clamp until I see it start to drip. And I want it to drip very slowly because obviously 1 drip every 3 seconds is not very fast. So I'm opening my roller clamp and I see a drip. And I'm going to time it on my watch. And I don't know how I did that on the first try, but it is dropping at 1 drop every 3 seconds. So, I'm just going to leave my primary tubing set there, checking to look at it. It still looks good. I don't see any infiltration at this time. So, we're going to let it run for approximately 4 hours. I am going to take my stickers, and this has the patient's name, date of birth, the medication, the IV solution, and it's also got the time and my initials on it. So I'm going to take that and put that on this bag without covering what the fluid is, because we want anybody that comes in here to check on her IV to know what the fluid is. So I'm going to remove my gloves. I'm going to perform hand hygiene. I'm going to lower the bed to the low position, make sure my patient's comfortable. Ms. Davis, are you okay in that position? Perfect. Okay, and here's your call bell. And if you have any problems or that starts to hurt or you notice anything that doesn't seem right, I want you to push the call button and call me. Okay? All right. Thank you, Mrs. Davis. I'll be back.